sparing time for us. Sir, I would like to ask you that what all in terms of e-governance is going on in the healthcare sector in Rajasthan?
In Rajasthan, we have taken various initiatives, particularly to facilitate the facility to be given to the last men. And I would like to tell you that so many initiatives have already been taken in Rajasthan, but in recent 1 year, after our new government has come in, some new programs have been launched. And there is emphasis on two things. Number one, how to use our limited resources in a better manner by using technology, particularly information technology. And secondly, how to give benefits to our own health workers, to our own employees using technology. So we are working on both aspects. It means we are providing facilities to our patients by using various software. Plus, we are using softwares and programs for facilitating the payment system, online payment system, etc. I would like to name some of them, like for our free drug scheme, we have an e-Aushadhi software in place. To make online payments and online monitoring of ASHA, we have ASHA Soft. And then to take care of child who are discharged from various malnutrition treatment centers and sick-born units, we have a voice message-based software. So in this way, in various fields, we are using various programs.
Sir, Rajasthan was not very much popular in terms of use of IT, if you've seen past some years. But we can see the softwares like ASHA Soft are doing tremendously good now. What is this about ASHA Soft, which is making it a very successful project?
Actually, the very basic of ASHA Soft makes it very popular for the reason that we have 46,000 health workers. These are known as ASHA Sahyogini in Rajasthan, and they get incentive based on their performance on 26 different parameters. When I was district collector in one of the district, I found that payment made to ASHA is not very smooth. It is made in various pieces. Then there were complaints of lack of transparency. Plus, ASHA also complained that they were not able to see for what activity they got it and for what activity they were refused. So they were not able to, work on their motivation thing, and their morale was going down. On the other side, if I say as an administrator, when I ask my ASHA person to tell me what ASHAs are doing, like what are the parameters, what are the dashboard indicators on which I can evaluate the working of ASHAs, I was told that there is no such mechanism. So there were two different problems. One problem, lack of payments on time. Number two, lack of monitoring parameters. So one will see two problems, but we saw one problem as a solution to another problem. So there came ASHA. What we did, we devised a system. First of all, we re-engineered the entire process of incentive payment. We brought out an ASHA incentive claim form, which was, ASHAs were given training. They were trained in how to fill the form. Then we devised a software with the help of NIC. NIC just could develop it in very limited time. Then thirdly, we issued various circulars and compiled them in a manual. So ASHA manual, it is known as. That ASHA manual is very much, informative. Anybody who wants to know about what is ASHA Soft, he can, go through that particular manual and can learn about this program in no time. So this ASHA Soft, it was developed very nicely, but I will say it was implemented very brilliantly. The excellent thing was done by my team, by all district ASHA coordinators, by block ASHA supervisors. They all worked very hard. And this teamwork actually made it possible to implement such a big software in just a span of 3 months.
Sir, ASHA is, you can say, the most basic unit of any healthcare system.
Yes.
How challenging it was to, compile, to do such a work with this basic unit of healthcare?
You have rightly said that ASHA is the basic unit. And second limitation is that, out of 46,000, 26,000 Ashas are either 8th pass or below it. So it was a real challenge to train them in implementing the system which is based on IT. There could have been various apprehensions. They could have been confused by various people with vested interest that the system is not good for you. But fortunately, Ashas were so much disturbed by the existing system, they were ready to experiment with anything. So we took hold of that particular end, and then we conducted very good trainings. And the best thing was developing a very easy claim form. And you will be surprised to know, we anticipated in advance that one day shortage of these claim forms may also come in. So what we did, we published in advance 6 lakh forms. 12 forms were compiled in a booklet, and 50,000 plus booklets were printed, and 46,000 Ashas were given one booklet each. Now, for 1 year supply of claim form is with them. So claim form is with them. They were trained in filling the claim form, and for last 3 months it is in practice. And we have found that more and more Ashas are coming into the fold of Ashas.
Also, sir, the reading writing of a language, English, can be a problem.
No, the form is in Hindi. It's in a very simple Hindi, and the form which they fill in, actually it is very much compatible with our software. So the person who feeds the data has no problem in feeding.
So can you tell me about your that voice related initiative which is being?
Yeah, actually in childcare we were facing a very big challenge. Rajasthan is known for incidence of malnutrition related problems, and also our sick neonatal care units, which are 36 in the district, and we have around 100 malnutrition treatment center. We were told that follow-ups were not good. Like once child is admitted, he is treated, and then he is discharged. When the child is discharged, parent is asked to come after 15 days or maybe 20 days, maybe 3-4 times in next 2 months. But we found that 15 to 20% parents were coming back. It was a big risk because those children, unless they are followed, were at the risk of death. So we have come up with an idea. SNCU software is already developed by Government of India. We developed a software for MTC with the help of UNICEF, and now both of those software have been integrated with an existing application available in the state with our Department of IT, which is a voice message based facility. Now what we have done, as soon as parents take away their children after discharge, we feed their mobile number in our software, and before the day on which they are supposed to come, 4 messages are sent in the morning, in the noon, in the afternoon, and in the evening, telling them that please, tomorrow is the day of your child's follow-up in that hospital, please come there. So earlier text messages were not successful for the simple reason that in villages we have cheap and basic fonts. They do not support Hindi fonts.
Okay.
And English messages they cannot read. So it was a very, very basic common problem. So now voice message has taken over. The Hindi messages have been fed in the system, and now they will start it getting. We have already checked the prototype, and we are now ready with our system, and we are waiting for an formal inauguration by our Honorable Chief Minister ma'am, and then we will launch it.
Sir, also the free medicine scheme was very popular and very successful scheme has been there in Rajasthan. In the terms of medicine, how you are using technology?
Rajasthan Medical Corporation was incorporated in 2011, and I must say that when the scheme was devised, the people who were behind this scheme, they took care of the IT needs also, and they devised a system. CDAC, I must appreciate, CDAC came out with a solution which is now known as eOshdi. Software was very good, but implementation was also very good, and the software was implemented through our warehouses and up to the drug distribution centers. So whenever some medicine come into the corporation after purchase, it is entered into the software. When a medicine is prescribed by a doctor to the patient and it is given to him or her, then an entry of issuance is made in the software. In this way, that software takes care of the stocks at various locations. It tells what are the stocks available in the warehouse of the Rajasthan Medical Service Corporation. It also tells what are the stocks available at the different PHCs and CHCs where doctors are there to prescribe the medicines.
So it helps in bringing more transparency also.
Yes, because every drug which is bought by the corporation is brought into the loop of EOHD. Stocks are entered into EOHD, and when stocks are sent from warehouses to drug distribution centers, again there is a software entry, and when drugs are finally distributed to the patients, then there is a software entry, and it's an integrated software. So at any point of time, you can know exactly what is the stock position at different locations. So you can deal with your near expiry drugs, and you can also order on time about those drugs which are getting expired soon, or which are not in stock. So later stage, because of scarcity of drugs, people can be annoyed. So to deal with that part, this software helps us to know when stocks are going to end, like in how many days at given consumption speed the stocks will end.
So what are your plans for future? In coming years, what are you going to do?
We have been instructed to make two big programs. One is regarding our equipment system. As you know, there is a big problem with government system that we purchase a lot of equipments and they are supplied to the different health institutions, and there is a general complaint from the public that these equipments are not working, or sometimes they are not put to use, and on excuse of one small default they are kept like that for months. So that problem we have captured, and now through use of technology again we have made a system which we have named as e-Upkaran. In this, all the 2,500 facilities of Rajasthan, which includes medical colleges, district hospital, PHC, CLC, there we will, in default, first of all, we will feed all the equipments. Then two types of information will be taken every day. Number one, how many equipments were not functional. If they were not functional, were they sent for repairs? And if they were sent for repair, if the complaint was sent to company, whether company responded, and if company responded, what is the time it will take in getting repaired. So first is repair and maintenance module. Second module is usage module. Because sometimes we see that a machine is working perfectly, but due to some mischief or maybe due to some other reason, hospital administration is not using it. So it is also very important to know in the evening how many equipments were not used at all. So in the evening we can take stock of under maintenance and not used. Then it will be very difficult for the people there to manipulate things.
So sir, finally I will like to ask you, what is your vision for e-governance in health? How do you envision this?
We are very much thankful to our Chief Minister ma'am, because she has a vision of IT, and she always says that governance is more important than government. And we have taken it in a real spirit, and our department with our very limited workforce is trying to implement this thing. And whatever intervention technology can make, we will use technology, but we will also ensure that technology is implemented properly. And impact assessment, I will say one thing, because this is the most weak link of the government system in e-governance. We create data, but we do not analyze the data.
Right.
So whatever system we will make, we will ensure that the data are used and decisions are taken, informed decisions are taken on the basis of that.
Thank you sir.
Thank you very much.